Hello, my name's Alex Barnacle. I am the BSIR Communications Committee Chair for this year, and I'm very pleased to be here this afternoon with my colleagues from the BSIR world. So, without further ado, Pete, can I ask you a little bit about the world of interventional oncology and how things have been in that sphere over the difficult period that we've had recently and how things are shaping up now?
Sure. Well, many centres have struggled to keep their services going, but everyone's tried as best they can, and I think things are now returning to normal, really. There's still been developments in IO, which I think is a really exciting field of interventional radiology. There's things like SIRT, which has now been approved for HCC by NICE this year, which has given a lot of opportunity now to develop that service in the UK and offer it to our patients. And that's really coincided with a lot of promising data showing how important dosimetry is for outcomes of these patients. There's also lots of exciting developments in the world of ablation, with increasing improvements in image-guided ablation and margin confirmation, which is really important to know that we're doing a good job for our patients.
Superb, thank you. And we've got iOUK over in Belfast next year to look forward to, is that right?
Yeah, so the iOUK meeting is another face-to-face meeting planned for June next year. And for the first time, it's going to be in Northern Ireland, so it's going to be in Belfast. So that promises to be a really exciting meeting with all the latest developments in IO showcased.
But before then, we've got the annual scientific meeting for the BSIR. How are things shaping up in terms of the programme?
Yeah, it's great, I think. So we've got lots and lots of speakers. I think it's been difficult getting international speakers across, but I think that's been an opportunity in a way, in that we normally in meetings gone by have had maybe a couple of speakers from abroad coming on to join us. But this time we've been able to have a sort of hybrid meeting. So it's face-to-face for the UK, but we've been able to have about 20 experts abroad from Asia, Europe, North America, all joining us to make it hopefully a great conference.
Yeah, it's really interesting how we found new ways to work through COVID that actually make the content and the shape of meetings different and hopefully even better. Ian, been a busy year for you, busy couple of years as the BSIR president. How's interventional radiology looking in the UK at the moment on the wider picture?
One of the strengths we've had is we've managed to work with the college, the Royal College of Radiologists, and actually bring interventional radiology to the table and actually help the college during these 2 years develop some guidelines. And I think that has put us in a really strong position that we now have a really fantastic working relationship with the RCR. I think when you look back, we did a few studies over the sort of COVID 2 years, and we've shown that actually centres which have day case beds themselves have done fantastically well in maintaining their workload. And actually, when essentially surgery was furloughed because of access to theatres, the remote location of interventional radiology has also been a benefit. So I think we've shown ourselves to be really a great source of day case activity in a COVID secure environment, and I think moving forward that should put us in a good position. The hard part is going to be keeping that momentum going as all the surgeons come back in and want all their beds back, and getting access to day case beds and admission rights and bed holding rights is going to be more of a challenge.
Yeah, absolutely. I'm sure there's a few more challenges ahead. In the background, I know the BSIR has been working hard on this, on the new IR registry. Tell me a bit about that.
Yeah, so I suppose the only thing I really wanted to do when I took over as president was actually get a registry up and running. And I think the reason for that was we aren't really anything without data. And one of the more surprising aspects was when I sat down with Tanya Van Buren to do the clinical service review and the spending review. One of the simple questions she asked me was, well, how many cases do you do a year? And I couldn't ask that question. And when we talked around the group, we asked about how many cases do we think we do, and we actually don't know our activity. And I think that's quite sad. And I think the registry only needs to be simple to start with. I think we can organically grow it over time to become something which might affect outcomes. But initially, we just need to know what we are currently doing, what's the scope of work we're doing, what's the breadth of work we're doing, and what is our sort of immediate complications. And I think once we have that data, we'll show we do a fantastic broad amount of work, which is actually done as day case and actually with low morbidity. So I think that will give us the evidence we need to progress us, as we are progressing as well. So I think it's really important. As with everything, it takes time to set these things up. It involves funding. It involves a lot of work from you guys and all the committees to actually get this thing going. But we're getting there. And I think Malcolm Johnson should be mentioned because he's been part of the driving force behind getting this going, and he's done a fantastic job. So Alex, obviously you're one of the highly specialized interventional radiologists in the country, specializing in paediatric interventional radiology. And I seem to recall at last count there was perhaps 12 of you in the country, and I think maybe you're down to maybe 10 now. I don't know. But how's the world of PIR going?
Yeah, it's good. We've had a strong year, actually, despite all the usual hurdles that everyone has been facing in the last 18 months. And you're right, although that's a controversial number, because actually the real issue is there are so many more people delivering bits and pieces of paediatric IR around the UK that are unrecognised and unsupported in that role. And those are really the people that we want to reach out to. I think the core group of PIRs who have that recognised in their job plan and well financed and resourced in their departments, we are few and far between for sure. But certainly going online for a lot of things this year in terms of raising awareness of paediatric IR and recruiting to our ranks and getting junior doctors interested, that's been easier during COVID than ever before. So we've seen a huge amount of interest online for some of the things that we've got involved with, both within the BSIR. We've done a joint webinar with the trainee group, with the International Paediatric IR Society, SPEAR. And we've done a PEDS IR webinar as well, and both of those are really well received. We've seen more PEDS IR within SIRT, ECIO, and the diagnostic meetings such as the BSPR as well. And it's great to see PIR again on the meeting agenda for this year at the BSIR. So I think things are good. It's still growing. Long way to go, but it's growing.
Yeah, I mean, I completely agree with you. I mean, I think getting interventional radiologists who would not necessarily say they are paediatric interventional radiologists to actually do paediatric intervention, which they're quite capable of, and to inspire them, as you've done with your webinars, and also to give them the support, I think is paramount to getting the service, more widely accepted. And thanks a lot for what you're doing.
Tell us a little bit about one of your particular interests, I know, and one that presumably you'll be bringing real focus to as the incoming BSIR president, about IR training in the UK, the shape of training, and trying to develop earlier access to IR for trainees and medical students and radiology trainees.
Yeah, well, I think you mentioned it there already, Alex. I think the key to this is catching people at a very early stage. And what I really like to see over the next couple of years is much increased awareness of not only radiology, but interventional radiology within medical schools amongst medical students. And I think I've got to congratulate BSIRT and IR juniors who've already made fantastic headway with this and raising awareness amongst medical students. And we've got to think long term. There's no point in just inspiring junior doctors. We've got to start right back with the medical students, and then they can see what an exciting and rapidly expanding specialty interventional radiology is. The other thing that we've been doing, and Ian has been pretty much instrumental with this, is getting direct preferencing for radiology registrars into interventional radiology. So as from next year, radiology registrars coming for interview will be able to preference interventional radiology, and as day one they will be badged as an IR all the way through their training. And this of course will make IR even more attractive for people who might otherwise have gone into other practical hands-on specialties such as surgery. And I think this is going to be a key thing to increase recruitment for interventional radiology.
Yeah, for sure. Interesting times, and hopefully a really good way of building interest in in IR much earlier on.
Absolutely, it's crucial.
Yeah. So Phil, tell us what's on the horizon. The incoming president, and with the ASM just around the corner, what do you see on the horizon over the next year or two for IR in the UK?
I am, as you probably know, a bit of a geek, Alex, and I love technology, and I particularly like technology that's useful and I can see a practical use to. And something that's I've come across recently is some NASA technology called fiber optic shape sensing, and it means you can put a fiber along a catheter or a guide wire, and you can see where it is in real time without actually using radiation, without screening. So you can do your basic run, say for an EVAR, and you can put your fiber optic catheter in, and the equipment will sense exactly where that catheter is to within a millimeter or so. So that with imaging fusion, real-time ultrasound coupled with CT scanning, I think is going to be we're going to see a lot of this in the future. It's really an expanding field.
And where do you think the other growth areas are in IR?
I think, as Ian had alluded to, I'd like to see more day case work. I think we've proven during COVID that things that we used to bring patients in for and have overnight stays for, actually we can do a lot of this as day case, like renal ablations, liver ablations, and some of these patients can indeed go home the same day. So that's going to be a big growth area, along with other areas within interventional oncology.
And then I'm going to circle back round to you, Pete. What do you think some of the biggest highlights are in the BSIR ASM programme this year?
A big highlight for me, I think, and many others, will be just having a face-to-face meeting and seeing everybody again. It's going to be fantastic, I think. The programme's a really sort of rich, diverse programme. A particular highlight for me is going to be the IR for Animals session, which has veterinary IRs from the UK, Canada and North America, all talking about the fascinating work they do treating animals using our innovative techniques.
Awesome. I can't wait. Pete, thank you so much. Phil and Ian, it's been great talking. I'm really looking forward to seeing all of this showcased at the BSIR annual meeting 2021 in Glasgow